Good morning. Gino Aragon here with you. And we have got a special guest in studio because we have Dr. Lukman Lawal. Did I get that right at least?
That's right.
Okay, good. Well, I'm just going to call you doctor from now on so I don't forget that one right there. But actually, Dr. Lawal is here with us today to discuss atrial fibrillation and stroke prevention in there. As you are the CEO of Southwestern Cardiac Arrhythmia Institute and president of the ASC of the Heart Institute, correct?
Yes, that's right.
Okay, cool. Now, I know that there's a lot involved in the medical industry and stuff like that. So let's tell us a little bit about yourself. Where did you kind of come up from and where did you start?
Right. So thanks for having me. Good morning. So I am a cardiologist by training, and so I treat all kinds of heart conditions. In addition to that, I also have an advanced training in electrophysiology, which is a subspecialty of cardiology that focuses on the treatment of heart rhythm disorders such as atrial fibrillation, patients who have pounding or racing hearts, patients who are blacking out and they don't know why, or patients who need pacemakers to be implanted, or patients who have a condition called POTS, P-O-T-S. So that's what I do basically. Now, apart from that, I also teach.
Oh, okay.
So I'm an assistant professor at Texas Tech University Health Sciences Center in El Paso. I am also a clinical assistant professor of medicine at the Burrell College of Osteopathic Medicine here in Las Cruces. So what I do is I teach medical students, trying to train the future doctors. I'm also the medical director of El Paso Community College Echocardiography Training Program. So I founded the Southwestern Cardiac Arrhythmia Institute in 2015, shortly after I moved to the area from Dallas, Texas. And we currently have offices in El Paso, in Las Cruces, in Deming, and in Alamogordo.
Oh, wow. That's a lot. You're definitely a busy person, and nice to see that your involvement with the medical industry also involves getting that next generation of medical professionals coming up and teaching them all the things that you know. So there's a lot of schooling that is involved, that you're involved in right now and teaching and everything, but there's probably a lot that you had to go through to get where you are as well.
Yes, that is true. So I did my when I moved to the United States from I was born and raised in Nigeria, so I went to medical school back home, and then I did some training in Ireland. I was briefly in the UK as well, in Europe. So when I moved to the United States, I did my residency training at the Johns Hopkins University and Sinai Hospital in Baltimore. It was a 3-year program in internal medicine. And then after that program, I moved to the University of Texas Health Sciences Center in San Antonio for my fellowship training in cardiology. That was another 3-year program. And then after that, I moved to Dallas to start another 2-year fellowship training program in electrophysiology. And then, so currently, I am enrolled in a master's program. I'm actually enrolled in the Master in Healthcare Delivery Science at Dartmouth College.
Wow.
It is a combination of, MBA, public health, and healthcare policy.
That is quite a journey to get you here into the Las Cruces and El Paso area for sure. And don't worry, we will break down some of the bigger words that kind of came down from there in a little bit. But obviously, your education, training, and what you do right now, you're a very busy person and very extensive right there. So with all of that information, all of that education, and everyone else can pretty much feel safe that you know what you're talking about. But I've got a few questions about atrial fibrillation, basically to kind of break it down for everybody that's out there right now. So that everybody can kind of understand. Like I said, we'll break it down as easy as we can. So we start off with that one question: what is atrial fibrillation? And what is its relationship to strokes?
Okay, so thanks for that. So now, atrial fibrillation is the commonest arrhythmia.
Mm-hmm.
It currently afflicts about 6 million Americans. And it is projected that by 2030, which is about 6 years from now,
Mm-hmm.
over 12 million Americans will be afflicted by atrial fibrillation. What is atrial fibrillation? Atrial fibrillation means a complete electrical chaos of the upper chambers of the heart. So, and this causes the chambers to beat in a very irregular fashion.
Mm-hmm.
When the heart begins to beat this way, this can cause blood clots to be formed inside the heart in a particular structure called the left atrial appendage, which is a very small structure that is located in the top left chamber of the heart. Over time, the blood clots can be dislodged, travel to the brain, obstruct a vessel, and then cause a stroke.
Mm-hmm.
Patients that have untreated atrial fibrillation are 5 times more likely to have a stroke. As a matter of fact, 20% of all strokes, that is 1 out of every 5 strokes, is caused by atrial fibrillation.
Wow.
So why is atrial fibrillation such a big deal? Well, number one, it can cause a stroke. Number two, it accounts for about 1 million admissions to the hospital every year. And number three, it costs the US taxpayers about 6 billion with a B every year. And this number does not include the cost of drugs and the cost of treating other comorbidities. So it is a big deal.
No, that's a very, very big deal, and not a lot of people really know about that. So, you kind of explained that it causes a clog, but are there any other causes for atrial fibrillation? I mean, what would actually cause this? This, I guess you could say, what did you say? Electrical chaos in your heart? Yeah.
Right. So, the risk factors for atrial fibrillation include age. So the older you are, the more likely you are to develop atrial fibrillation. Although now we're beginning to see atrial fibrillation more in the younger population. Now, apart from age, the other risk factors for atrial fibrillation include high blood pressure, which accounts for or is associated with about 56% increase in the risk of atrial fibrillation. Diabetes is associated with about 40% in the risk of atrial fibrillation. Heart failure is a risk factor for atrial fibrillation. Smoking is a risk factor. Alcohol, if you have coronary artery disease, that is a risk factor for atrial fibrillation. There are other risk factors such as genetics. It's also more common in males. So being a man is actually a risk factor. And then the other risk factors also include obesity, sleep apnea. If you have sleep apnea, you're 5 times more likely to have atrial fibrillation than if you don't. If you have thyroid problems, especially if you have an overactive thyroid, that can cause atrial fibrillation. And of course, sleep deprivation is a risk factor for atrial fibrillation.
Okay. Well, that's a lot of things that can actually contribute to that. So there's definitely a lot of a concern for a lot of people, and I can understand how 1 million people can be affected by this every year, because that is a lot. But how would you be sure that you have it? I mean, what are some of the symptoms that could give you that clue that you might have atrial fibrillation?
Some patients with atrial fibrillation may not have symptoms at all. And their false symptoms may be that of a stroke. And especially in patients who do not seek regular medical checkups.
Okay.
But the common symptoms of atrial fibrillation include fatigue. Patient will tell you they feel tired, no energy. They couldn't do the things they used to do like 6 months ago or 1 year ago. Some of these patients may blame this on age. I mean, they may tell you, oh, because I'm probably getting older, that's why I feel so fatigued. But that may not be the case. right? So fatigue is a very common symptom of atrial fibrillation. Also, some patients may be winded very easily. I mean, just walking for just less than a block or two can make them feel very winded. Some patients may have chest pain. Some may have palpitations, which means they may actually feel their heart racing or skipping beats. Some may black out. So these are some of the symptoms of atrial fibrillation, but the commonest ones are the fatigue and the shortness of breath.
Oh, wow. Okay.
Yeah.
And how do you diagnose atrial fibrillation? Is that something that you can actually diagnose with a lot of, because a lot of those symptoms could be symptoms for other things as well. So how would you actually diagnose it?
Right. So the best way to diagnose atrial fibrillation is by doing what we call a 12-lead EKG or a 12-lead ECG. That is the best way to diagnose atrial fibrillation. Now, your doctor may listen to your heart and your heart may sound irregular, but just because your heart sounds irregular doesn't mean it's atrial fibrillation, because there are so many things that can cause your heart to be irregular.
Yeah.
So the EKG is the best tool to diagnose atrial fibrillation. We do have lots of new technologies now, such as some watches, right, that can actually tell you whether or not you have atrial fibrillation.
Wow.
But some of them are not very reliable. So the best way to diagnose it is to go to your doctor, have your doctor listen to your heart and do an EKG. And the ECG will tell you whether you have atrial fibrillation.
Wow. Okay. And can this be treated? Is there something that you could do for atrial fibrillation?
Atrial fibrillation can be treated. Now, there's no cure. There's no cure for atrial fibrillation per se, right? But it can be treated and managed well. Now, when we talk about treatment of atrial fibrillation, we have to, first of all, treat the atrial fibrillation itself, number one. Number two, we have to treat the patients for stroke prevention. And then number three, we have to treat the other comorbidities that we talked about, like high blood pressure, diabetes, sleep apnea. So talking about treating the atrial fibrillation itself, we can use medications to control the heart rate. And there are all kinds of medications. We can also try to convert the patient back to normal rhythm, because some patients feel better if you convert them from atrial fibrillation back to normal rhythm. Now, how do you convert patient back to normal rhythm? You can use medications to achieve this. Sometimes you may need to shock the patient's heart. You're trying to restart the heart, right? We call that synchronized cardioversion. And then sometimes patient may need to have a procedure called ablation of atrial fibrillation. This procedure involves passing catheters through the groin into the heart, and then we cauterize the top chamber of the heart to stop the atrial fibrillation. Now, once you've treated atrial fibrillation, or even before you treat atrial fibrillation, you have to start thinking of how do you prevent stroke in these patients. And the way to prevent stroke is to treat the patient with blood thinners. Now, there are some patients who cannot tolerate blood thinners because of bleeding. Or because they're very unsteady, and they can easily fall and hit their head on the ground and bleed. So patients who cannot tolerate blood thinners, we can implant a device called a Watchman, which is a small filter that goes through the groin into the heart, and we place it in that structure that we talked about earlier called the left atrial appendage. You recall that most of the clots that are formed inside the heart are formed in this little structure called the left atrial appendage, which is located in the top left chamber of the heart. So the Watchman device is a small filter. So we put it inside this left atrial appendage to occlude this structure. Now, once this structure is occluded, no clots can be formed, right? And there will not be any need to take a blood thinner. So the Watchman is an alternative to blood thinners. And then finally, we have to remember that once you treat atrial fibrillation, and then we treat the patient for stroke prevention, we must also attend to the other comorbidities, such as sleep apnea, for example. because in order for the treatment to be effective, we also have to treat the other comorbidities. So patients that have sleep apnea, for example, they must be treated with a CPAP machine, right?
Yeah.
Other means, there are other ways of treating sleep apnea, but CPAP machine is one way of doing that. So that's the treatment of atrial fibrillation in a nutshell.
Yeah, well, that's a lot. That's a lot for somebody to take in. But at least I can, from what I can see, there are certain levels that you can go to go, hopefully, to be able to go ahead and take care of that. So it's not immediately you have to do the surgery or you have to go in through the groin to put that blocker up there, that filter. So it looks like there are at least certain levels on there, and there's some medications that could help out as well. But I guess it really all starts with talking to your doctor about trying to go ahead and diagnose that, correct?
Absolutely.
So, on your next doctor's visit, or if you're feeling some of these symptoms, maybe go ahead and ask your doctor to go ahead and take a look at those, and if they can go ahead and diagnose that, because as the old GI Joe saying, knowing is half the battle. And if you know and have a little bit more understanding of what it is or why you're feeling the way that you do, then you can take those steps to go ahead and make yourself feel better.
Absolutely.
So you would encourage everybody to at least ask their doctors about this and then kind of go from there, right?
Absolutely.
Is there anything else that we want to make sure to let everybody know, or any other information about atrial fibrillation, or maybe about what you guys do with that?
Yeah. So if you feel your heart is racing, if you're feeling fatigued, if you don't feel yourself, if you're short of breath, please seek medical attention, especially in the older population, because they tend to blame, getting fatigued on getting older, and that may not be the case. So if you feel anything unusual, chest pain, shortness of breath, you feel your heart racing or skipping beats, please see your doctor, and your doctor will listen to your heart and maybe do an EKG. And if you have atrial fibrillation, your doctor should refer you to a cardiologist or an electrophysiologist as well.
And you mentioned that this happens a lot with some of our older folks, or as you get older, but you did mention you see it a little bit more in younger. Like, how old would you say is old that you might have these concerns about that?
Right. So right now, if you are 40 years or older, more likely than not, you're going to have at least one episode of atrial fibrillation. We are beginning to see atrial fibrillation even in the teenagers now.
Wow.
The youngest patient that I've seen with atrial fibrillation was about 17 years old. And the youngest patient that I've performed ablation on was a 22-year-old lady with atrial fibrillation.
Wow.
A lot of times is, like I said earlier on, a lot of factors account for atrial fibrillation in the younger population. Genetics is one of them. And of course, lifestyle is also one of them as well.
Yeah. And I suppose when you talk about genetics, family history of heart issues or anything else like that, obesity, diabetes, stuff like that will all be a factor for atrial fibrillation.
Absolutely.
Okay. So as it stands right now, the best thing to do if you have any questions or concerns about that would be to go ahead and talk to your primary doctor and get tested to go ahead and know. And then the next steps, of course, will be taken with your primary care doctor and whatever other specialist that you get to with a cardiologist or someone else that they sent you to, right? So,
that is correct.
Okay. So there are positives. I don't want everybody to think that there are, it's doom and gloom right now. There are things that you can do to go ahead and make it better.
Oh, absolutely. I mean, there are treatments for atrial fibrillation, and even with lifestyle changes, you can actually reverse your risk of developing atrial fibrillation. And, once you have a cardiologist or an electrophysiologist who manages the atrial fibrillation, and you're compliant with your medications and you take all the right steps, you will be okay.
All right.
Yeah.
Excellent. Well, before we go ahead and finish up, are there any last things or any last words that you wanted to go ahead and let everybody know before we end up?
Right. So atrial fibrillation is a very serious condition that should be taken very seriously by everybody. Most people don't think about it. Just because some patient may not have any symptoms at all. It's very important to have routine medical checkups by your primary doctor. And if you suspect any of those, or if you develop any of the symptoms that I mentioned, like fatigue and no energy and shortness of breath, please consult your doctor. You can also consult a cardiologist directly. I think it depends on what kind of insurance you have. Some patient can go direct to see a specialist, or you can just go to your primary doctor and make sure they listen to your heart and do an EKG. And we should take it very seriously, because one of the biggest fears of atrial fibrillation is a stroke.
Yeah.
And unfortunately, because some patients do not have any symptoms, their first symptom, unfortunately, may be a stroke.
Yeah. And that strokes are nothing to laugh at so much. I think I mentioned before we started that I had hemorrhagical stroke about 6 years ago, and was lucky enough to get to the doctor. So that would be one of those things that would be a concern for anyone, because of that, once again, medical history that goes back to all of that as well. If anybody did have any questions or to learn a little bit more about that, could they contact the Southwestern Cardiac Arrhythmia Institute or ASC of the Heart?
Please do. Yes, you can contact us, or you can just go to our website, and we have all our contact information there, the emails or the telephones. And we'll be happy to respond to your questions.
Okay. And what is the website?
So it's www.southwesternheart.com.
Okay, excellent. So you can get a little bit more information about atrial fibrillation and a lot of the things. And if you have any questions, all that contact information is there. Once again, thanks for coming in, Dr. Lawal, and thanks for giving us a lot of this information. Once again, the information is the key, and the understanding of what's going on is going to make you more aware and what you have to do to go ahead and make yourself better.
Thanks for having me.